What happens if a staff member at a long-term care home gets sick?
So our usual course of action for any staff member who is sick is to have them stay home and self-isolate. In the event that staff suspect that they may have COVID-19, there is required testing, and during this time they will not come into contact with your loved ones. They will be at home and follow the direction very closely from our public health officer. In addition to that, our public health officer works closely with our Canadian border. And for any staff, family, visitors that are coming through our border, any restrictions for mandatory self-isolation for the required 14 days will be communicated at that time. In addition to that, any members who are coming from countries of concern are also required to self-isolate in the event that they begin to show any signs or symptoms and are concerned about COVID-19. Is that okay?
Yeah, that was perfect. I mean, it's perfectly delivered. I'm just trying to think it was all accurate.
Might not be.
No, I'm just trying to So,
Sold it well, though.
yeah. So the difference between your last 2 points, one was that the border control will tell them to self-isolate.
Yeah.
And then the second one is around self-isolating only if they're showing signs. So was that because that's more broadly about any impacted area?
Any impacted area, and because the countries will change,
Right.
right? So if you have been traveling, the advice from Bonnie right now is, even if the border official told you you don't have to do mandatory, if for some reason you've traveled abroad, been on a cruise ship, and symptoms start to occur, automatically self-isolate, get yourself calling 811 is what she says.
Okay.
But
We don't have to say that
we don't
here.
talk about that here.
Okay, I think
Right.
that's clear. Well, I might get you to do it just one more time, just to see.
Kill me.
Too
Do you
much?
want me to not say that at the end then?
No.
Okay.
I'm just trying to get it clear from the public's point of view, the difference between those last 2 points. It's
Yeah.
the way you've described it now. I'm just wondering if there's a simpler way to say it, is
Yeah.
that, you know, if staff have been traveling to any of the impacted areas and are showing any signs, they will not be at work, kind of thing. They will be asked to self-isolate from either, from probably both public health and the border control, as well as the employer.
It's a lot to remember.
Yeah.
Okay.
Yeah. But
Okay.
it just maybe, and we're gonna use that other one's fine how it is, but if we can also have something that's, that even if it's like staff that have traveled to the impacted areas and are showing symptoms of COVID-19 are being told to self-isolate at home, they will not be coming to work.
Okay.
Something as simple as that.
I think you should
No,
No,
this
no.
isn't
Way.
it.
I'm the word here, it's good
No,
looking.
you're
The
just-
Joanne touch. No one's.
Not the communication
So-
on that. I like that. Should have an earpiece with Justin.
Yeah.
There you go.
Like off a time.
Yeah, exactly. Next fiscal budget, put it in there. And it's like earpiece.
Okay, so just
I was
do
gonna
that
say.
line and that's it.
Okay.
No
To
problem.
remember it, no problem.
Okay.
For any staff who are coming from infected areas around the world who are showing any signs or symptoms of COVID-19, they will be asked to self-isolate for the required 14 days. That is supported through our public health office and our organizations in order to contain the spread of this illness.